Hello, and welcome to the Joss Brown Podcast. With over 40 years of combined financial planning experience, we will discuss our favorite topics, concepts, and stories. Hello, welcome back to the Joss Brown Podcast. I'm Devin Joss. We're here with Catherine Brown and our special guest, Rodney Jackson. He is an insurance broker from our Jackson Insurance Agency over in Yorktown, Virginia. He grew up in New Orleans, Louisiana, grew up in a small town. He went to high school, graduated, went to one semester of college, and went straight over to the U.S. Navy. So how was that?
That was an awesome experience. It allowed me to get out of Louisiana without having to really pay for it. And from there, this is how I ended up here.
Mm-hmm.
So being in the military really taught me a lot, and I wouldn't change it for nothing.
Yeah.
Sir.
So moving from the Navy to where you currently are, fast forwarding to your current profession of Medicare planning, that's what you specialize in, correct?
Yes, sir.
Yeah,
Yes, sir.
So just starting out, I guess, Catherine, you want to talk about how we work with Medicare planning before retirement, during retirement, and after?
Sure. So here at Joss Brown, when we are working with a client and we're helping them with retirement planning, a big part of that is planning for health care and planning for the cash flow and the expenses that go with health care. So,
Sure.
so understanding what the costs are going to be and what options they have is an important part of people's next steps after retirement, especially if they're retiring right up to that age 65 number.
Yeah,
So,
Great. Rodney, can you talk a little bit about each part of the Medicare?
Sure. Well, Medicare has two parts. There's Part A, which covers hospitals, the hospital part, and there's Part B, which covers the doctors. And so Medicare was implemented back in 1965, and so there were two parts. And as time went on, it was progressed. And then we have the Medicare Advantage plans, which are Part C plans. We have prescription part, and we have Medicare Supplement that picks up the 20% that Medicare doesn't cover. It sounds confusing, and for many people, it is confusing. And so, what I like to do is just do a breakdown and a divide. My biggest thing is education. I feel better when someone knows the product when they leave my office, and that's my number one question. What have you learned since you've been here? I hope you tell me you did learn something. And if you have not learned something from our discussion today, feel free to email me any more questions or whatever. But it's complicated. The rules change often. CMS is the agency that regulates Medicare and Medicaid. CMS stands for Centers for Medicare and Medicaid, which is a federal agency that allows the private insurance company to contract with Medicare in order to provide private insurance to Medicare recipients.
now a lot of people ask me, they get confused and they come in and they say, I'm getting ready to retire. I'm signing up for Medicaid. So can you tell us what the difference is between Medicare and Medicaid?
Sure. Medicare is federal, and Medicare is a federal health insurance plan for 65 and older, or anyone that's been disabled for 2 years or more that's under age 65. Medicaid is federal, but it's mainly ran by a state, but it's funded by the federal government. So each state Medicaid department is ran different. So the terminology, they're close in the wording, but they're not signing up for Medicaid especially if they have assets. They don't want to sign up for Medicaid. They want to sign up for Medicare. Medicare only covers 80%, which is 80%, and you're responsible for 20%. 20% of what? And that's a percentage. So Medicare being a fee for service, anytime you go, you're going to pay a fee. And that fee can be astronomical. A person can find themselves bankrupt financially if they don't find something to cover that 20% because of all of the fees and the misunderstanding about Medicare. A person will misinterpret wording that the government put in place, and if there's not someone to explain it, they'll get frustrated and they'll just go hide in a corner somewhere and just not even deal with it. But the bills are going to continue to come.
So are you saying that the Part B covers 80%? Is that right? And then you get something else to cover the other 20?
A and B is
okay.
The total 20% is A and B.
Okay.
And so, because the A is covering the hospital portion, which you're not paying for. You pay for that when you work through FICA taxes. The Part B, there's a Part B premium, and that's a monthly premium. This year, 2023, the premium is $164.90. Last year, the premium was a little bit more, so it was reduced for 2023. So we don't know what it's going to be for 2024 because it fluctuates. When Medicare was first implemented, that Part B premium was $3.
Wow.
$3 a month.
Inflation, huh?
Yeah, and so, but the 80% that's being covered by Medicare, they really don't care if a person covers the 20%. The government, during the annual enrollment period, they're only concerned with the prescription part. Now, I know this is being broadcast and someone may disagree, but with the rules, the government is like, we're giving you 80%, so you can figure out the 20%. The Medicare Advantage plans will cover everything, but if someone is not aware, the 20% will go uncovered. Most times, there is prescription coverage put in place, and if a person is not, so let me backtrack. Medicare, when a person when they're first eligible for Medicare, there's a 7-month window, and so that's 3 months before they turn 65, the month off, and 3 months after. And so that last month, if they don't have what is considered credible coverage per CMS, they're going to get penalized if there's no prescription coverage in place. And the penalty is a 1% penalty every month that the coverage is not in place, prescription coverage is not in place. And once they find prescription coverage, the penalty does not go away.
Wow.
It stays in force. And so I've ran into clients that their budget is so tight. This one guy called me panicking. Someone had switched his plan, and one plan was a 0 premium because Medicare takes and pay the private insurance companies a fee, and so they can offer 0 premium plans, HMO plans, PPO plans. Those are the Medicare Advantage plans, Part C. And so someone switched this guy's plan, and the guy was having to pay a monthly premium on this plan, and I mean he was upset. So because his budget was that tight. And so I found a way to get him back to a 0 premium plan, because with anything you have to know the laws and the rules. So when you know the rules and the law, you can work, in the system and not be illegal and not be, going against what the government is telling us not to do, because it's their rules. So I'm just following their rules.
So he had the Part A, which is, there's no fee for that, right? And then he had Part B, which was about 164, you said.
90, yes.
And then 90. And then Part C was the Medicare Advantage. He didn't have any premium with that. Is that what you were saying?
No premium.
No
Until
premium.
someone came in and switched it.
Yes.
And caused him to have a premium.
Wow.
Now, what insurance, what if people when clients ask a question, if I pay a premium, they're wondering, am I going to get paid more? No, it's not the case, because the commission is already set. So if a person has a premium, I'm not going to get any more than if they don't have a premium. So, but the person, I don't understand why he was switched, but there are 800 people that work behind desk. They're at call centers, and all day they call folks.
Wow.
And if you bite on the call, they're going to sell your product.
So you talked about Medicare Advantage, which is Part C.
Sure.
I've also heard of the Medigap. Is that also Part C, Medigap coverages as well?
That's not considered Part C. And the Medicare Advantage plan and the Medigap plan, you can't have both. It's either or. So the Medigap, which is Medicare supplement, it picks up to 20%. The 20% that Medicare does not cover. So there are Plan A. There are different plans. The plan the most popular plan out now that when I speak to agents, is Plan G.
Okay, yeah.
There was Plan F, but until 2020, you cannot enroll in a Plan F unless you turn 65 before 2020. So, but anybody that's age in after 2020, they cannot get a Plan F.
Okay.
So,
yeah, I remember. I think my mom has one of those letters.
Yeah.
F for G, and then Part D, which is the prescription coverage, right?
Yes,
How much
ma'am.
does that run? Is that expensive?
It depends. So I was sitting with someone yesterday looking at different prescription coverage. So her and her husband, they are in retirement age. So he's pretty much retired. So I set him up with a Medicare supplement plan and prescription coverage, but his medication list is minimum. So it depends on the amount of medication that someone is that they're taking. Okay. And so what I like to do is, Medicare has a website. The website is medicare.gov, not medicare.com. So the medicare.gov website allows me to go there and put their information in, because it's an unbiased website. And once I put the information in, every company from the least expensive to the most expensive will come up. And once it comes up, it'll tell me the annual cost for the prescription, the monthly cost, and preferred pharmacy, and so it allows me to see, everything. And that's how I determine how someone or where someone should purchase their prescription coverage from.
Okay, great.
Yeah. We hear sometimes that people say to stay away from Medicare Advantage. So what are your thoughts on that? And can you explain some maybe pros and cons?
Well, I work with both. I work with the Advantage plans, and I work with the supplement. So it boils down to need. So their clients, their budget is tight. They have a fixed budget. So Medicare Advantage plans, most of those plans have a zero premium. It's easy for someone to want to get in those plans. So those plans is a zero premium, zero copay for primary doctor. Specialist the cost is minimum, maybe $15, $20, $25 a month. I mean, not a month, but when they go, sorry. And their cost for different doctor visits. And there are co-payments versus co-insurance most of the time. A co-payment is a set dollar amount, and co-insurance is a percentage. And so with the Medicare Advantage plans, you have everything wrapped into one. The doctor and the prescriptions are all on one plan. With the supplement, the Medicare supplement does not cover prescription coverage. So you have to get a separate prescription plan if you are going to enroll in a Medicare supplement plan. And so, and to answer your question, I just look at their needs. We talk budget. What's your budget? What's your need? What's your health? I don't ask health questions, but if someone is, I have a client. I had a client that she was like in a rush to get on Medicare. because she was on regular health insurance through the affordable health care.
Mm-hmm.
And she said, if I go get this surgery, my deductible is $4,000.
Wow. Yeah.
And she said, I only have a couple months, so I'll get this Medicare plan. And so she decided to go with a Medicare supplement plan. And with the Medicare supplement, there's an annual deductible for Plan G. The annual deductible is $224 or $26. That's an annual deductible.
Mm.
Once that deductible is met, there's no more out-of-pocket expense except for the monthly premium.
Wow, that's great.
Yeah. So on Medicare Advantage, when you go to a doctor, the first night in the hospital, you may have to pay $250. Mm-hmm. So if you're in the hospital for 2 nights, that's $500, and the insurance company is going to pay their portion, and the hospital is going to send you your bill, and so that's the difference.
Mm-hmm.
Hope I answered that question.
Yeah. Are there any challenges changing from plan to plan?
Well, with the Advantage plan, we have enrollment period, which runs from the annual enrollment period runs from October 15th through December 7th, and those when anybody can switch. Anybody who has Medicare, if they have a Medicare Advantage plan, they can switch that plan as long as it's done before December 7th. So last year, because the governor mandated a what is called emergency, we were able to enroll individuals up until December 31st, and their plan effective date is January 1. Now that's even for the December 7th cutoff date. The plan becomes effective January 1. Now with the Medicare supplement, you can enroll in those plans like year round. So if someone has a Medicare supplement plan and they're like, hey, I want to see if I can get my premiums down, and they have a plan F and they have good health, they can go to a plan G. If it's May, we can change it. So there's no enrollment period for that. The only thing with those folks is the prescription part, because the prescription part falls under the enrollment period, which is October 15th through December 7th. And then from January 1 through March 31st, there is open enrollment period. So if someone has a Medicare Advantage plan that they signed up for in during the open enrollment period, and come February 1st, and they're like, I don't like this plan, I want to change. They have a one-time chance to change from one Medicare Advantage plan to another.
One time total in their whole.
Well, during that period,
okay.
yeah. So
Wow.
once they make that decision, that's it until the next enrollment period. So.
What are a couple challenges you see with your clients when they turn 65 and they decide on Medicare?
I think the biggest challenge is confusion. Now that's not the case for everyone, because there are some people that they read a lot, they talk, they look at videos, but I would say confusion and trust. And that's where, word of mouth referrals come into play. Most of my business is referrals. And when I first got into the insurance business, I started working with a group of guys, and these guys they were making pretty good income. But when I was in the military, I was a machinist mate. I worked down in the engine room. We turned water into steam. So I didn't really want to deal with anybody. And then when I went to my next ship, it was an aircraft carrier. We were the guys who were responsible for the jets being propelled off of the ship. So when these guys asked the question, hey man, you want to work with us in the insurance business? I'm like, man, I'm not a salesman. But then I realized that inside of each of us there's a gift. And I started to read books, and I was like, I don't know. Let me try. Let me think about this. And so as I started figuring out who I was, these guys, their approach was sales. And I said, you know what? I'm gonna educate. I'm not going to look like the typical sales guy. And that's what I wanted to do. I wanted to educate folks. And it took a lot of reading because Medicare was complex, especially when I first got into business. I was working with a company. I first started off as a W-2 worker. And I was working with this company, and I don't know, I just couldn't figure things out. And I was like, I don't know. So what I did, I was like, I told my wife, I said, I'm going to stop doing this. And I started reading this is a brochure. It's called The Evidence of Coverage. And I would be up till 3 in the morning just reading and reading and praying. And I was like, Lord, I got to figure this out. And just one day, it was like, I got it. And that was it. And so, but back to your question, many folks they don't know who to trust. They're confused. And they just want someone who knows what they're doing and knows, can answer their questions. Now, if I can't answer a question, I'll let them know. I'll write it down and I'll get back with them. But I try to make sure that I cover all bases, because people can go online and look and read, and that's what I've told many folks. You can't just tell people anything today because they can go search it out. And so, but yeah. So
I remember you said there was an advantage to working with an agent, somebody like you, versus calling, ARP or AAA or something and signing up. So what are some of the advantages that your clients have seen by working with an agent rather than an 800 number?
Well, that's a good question. I had a gentleman that he called the 800 number. So he'd been working with me and everything. And I'll tell all my clients, I say, if you want to go, and deal with those guys, you're free to go. I'm not going to hold you hostage. I don't believe in that. And so he called and he said, man, the guy on the phone, he spent a lot of time with me. Now I'm thinking in my mind, this was one day. I've spent like days with you and weeks. So I said, it's fine. I said, it's okay. No hard feeling. And that's one thing I told my wife. I said, business is never personal. And so the guy, he started dealing with someone. And I told him, I said, well, I'm going to tell you this. When you call that number back, you're not going to get that same person. And the guy was like, oh, okay. And I said, okay. So I said, anything changed, I tell all my clients, if anything changed, just give me a call. And he called me back. And he said, you were right. And the guy, I never got the same guy. And I didn't say anything. I said, so what's going on? Well, I need this, done. And I was like, yeah, sure. And so I don't hold it against them. But having an agent like myself, you can call me, I'm local. And I even have clients in other states. And they call as well. I have a gentleman down in Georgia. We don't talk all the time, but if he needs me, he'll call, leave a message, and I'll call him back. And he's always so gracious. He's like, thank you for calling me back. And I believe that's because the person he dealt with before didn't call him back. And so I want to make sure I get back with folks. If I don't answer at that moment, I will call you back. And so just to make sure that I answer any questions. Sometimes it's an emergency. They're not able to get medication, and I can call the company, and we can make some things happen for the folks if they are in need. So, and just point them in the right direction.
That's great. It's a big advantage. So.
Yeah. You mentioned a lot of disadvantages with calling those 800 numbers. There can be confusion, and that you like to educate your clients.
Sure.
So what do you like most about insurance planning?
Well, just seeing a difference in their whole demeanor. When you and sometimes when it's my first time meeting someone, you can tell when someone has their guard up. So
Mm-hmm.
it's like I can tell, and I'll just start asking questions. You gotta, you make a friend first. You wanna, ask questions about them, about their family. Just try to find out a little bit about them first. I learned this from a guy, the guy I went through the insurance training, and this guy was good. He was real good, and he was, teaching us about insurance, but he was also teaching us about sales. And so a lot of his training was, I was like, wow, this is pretty good. And so you make a friend and you find out their need. You don't go in there and that's one of the things I like to do when I'm sitting with a client is space my appointments out. Mm-hmm. I don't want to have someone rushed. So I'll give them enough time so they don't feel rushed. And when people feel rushed, they don't feel important. And so they need to feel important. They need to know that you're not just there to get a quick sale. I had a guy tell me when I sold long-term care, I went through a training, and this guy was good, and he always talked about commission breath. He said, people can see it all over your face, and I was like, what is this guy talking about? And one day it just hit me, and I was like, if I rush in this house, and this person is explaining or talking, and I'm just like, okay, hurry up, let's go. I got somewhere to be. They're gonna pick up on that, mm-hmm. and that's what I didn't want to do. And some seniors are lonely, mm-hmm. Some of them I've made friends with, and I'll just go and sit and talk to them, and they just need someone to talk to, someone to listen to, because they just don't. When you go and visit a senior, and they haven't had a visitor all day, it's golden to those guys. They're like, hey, come on in, and I already know. Do you have somewhere to be? Nope. Made time just for you. So, you just got to know who you're dealing with, so, yeah.
Great. All right. So, do you have anything else you wanted to share about Medicare? That was very helpful.
Yeah.
Sure. Well, the one thing I will say, there's no dumb question. So if you're in front of an agent or someone like, myself or another agent, ask questions. And literature purposes, there's a handbook that Medicare sends out. It's called the Medicare and You book. Mm-hmm. And I would highly recommend that Medicare recipients read that book. Now, you don't have to read the whole book, but just go through it and familiarize yourself with the terminology and what Medicare will cover, mm-hmm. and what they won't cover. And also the Medicare.gov website. You can go to that website. I will also say this also. Don't just take a person's word if they're telling you something is free, mm-hmm. because zero premium doesn't equate to free. If you have a zero premium, there is going to be copays sometimes. So I never tell a Medicare recipient that this is free. There's a cost. And so I hope that the Medicare recipients this year, they're tuned in, they don't get hooked in by the commercials. And once again, the enrollment period runs from October 15th through December 7th. So,
thank you, Rodney, for joining us on this week's episode.
Sure. Thank you.